Hello, and how are you guys doing? My name is Justin Eugen, here with you again, and today we are going to discuss how the roles of healthcare are expanding. All right, now question one asks, what is a mid-level provider? So in order to get a better understanding, let's go over what a provider is. A provider, in terms of healthcare, is a person or company that provides a healthcare service to you. In other words, your healthcare provider takes care of you. The healthcare provider everyone's probably most familiar with is their PCP, or primary care physician. And these type of healthcare providers deal with womb to tomb, birth to death, in other words, continuum of care. But there are all different types of healthcare providers. Any type of healthcare service you might need is provided by some type of healthcare provider. And some examples of non-physicians are your pharmacy, your urgent care center, and a physical therapist. There's different levels of providers also. Going back to the question of what is a mid-level provider, let's go back to what is an entry-level provider. An entry-level provider is those putting their foot on hospital doors and trying to getting to know the system, such as certified nursing assistants, medical assistants, hence the word assistants, trying to get to know the system. Then we go on to mid-levels, which are registered nurses, optometrists, to say a few. And these are healthcare providers who have received different training and have a more restricted scope of practice than physicians, but who do have a formal certificate and accreditation through the licensing bodies in their jurisdictions. Now, the scope of practice describes the procedures, actions, and processes that a healthcare practitioner is permitted to do in keeping with their terms of their professional license. So, an example of scope of practice, nurses. Nurses, fun fact, there is over 2 million across the country. Nurses alone. But even though they do so much, they help out so much, nurses are only allowed to perform patient care. Crazy, right? Now, high-level physicians are physicians, primarily the ones that do surgery. The difference, there's some key differences. For example, let's take a physician assistant who is a mid-level and a physician who is a high-level. The difference between them is that a physician assistant does 80% of what the physician does. And there's an 18-month program that they can take compared to a doctor taking 7 to 8 years in schooling. Crazy, right? And also the physician assistant does clinical rotations, to name a few. Question 2 asks, where do complementary and alternative medicine providers fit in? Okay, so CAM providers, fits in on functional medicine. And functional medicine is everything doctors can't fix through biomedicine. It's they should fit in as the lowest risk, most conservative choice, most inexpensive choice, and also the first choice. But doctors don't like to refer to CAM because they want to get it right. We live in a world where in the healthcare setting, doctors are competitive. They want to get things right. They want to be awarded for their efforts. So they don't really refer to CAM unless they really have to. Complementary means you work in the mainstream. You complement mainstream medicine. It's Eastern. Also, alternative is not mainstream. Some examples of CAM is acupuncture. Acupuncture treats pain. It's a treatment. It's a modality. So in essence, the world of healthcare is going upside down. In words of Steven Stumpf. So thank you for watching. I'll see you again next time.